So now you should be able to pick it up. In case anybody's on there, we're just waiting for a few minutes, and then we're going to try this first ever Facebook Live seminar from our clinic. And if it goes bad, it's Josh's fault. If it goes great, it's my fault. Anybody's on there, we're just waiting for a few minutes, and then we're going to try this first ever Facebook Live seminar from our clinic. And if it goes bad, it's Josh's fault. If it goes great, it's my fault. So we get going. You won't want to be right next to me, right? Because you'll hear we'll go back and forth onto this from that. All right. Anybody's on there, we're just waiting for a few minutes. Okay, I don't know how many of you are out there today, but thanks for joining us for this live Facebook seminar. Hope you don't have the COVID virus. Hope you're staying safe. Just to get your minds going, we have a little mental challenge for you. When I ask you the following questions, I want you to say the answer out loud within 1 second of hearing the question. Now, if you're not alone and someone's with you, and you get the answer wrong, the other person is immediately supposed to make fun of you. So here goes. How do you pronounce TWA? Next one. How do you pronounce TWE? Next one. How do you pronounce TWI? Last one. How do you pronounce TWO? If you pronounce the last one TWO, you're wrong. It's two. Okay. So we're with Physical Therapy and Balance Centers. Typically, we've been doing these seminars live once a month here in the Ogden Athletic Club. But because of the COVID virus, we thought, well, let's do them live because people can still learn the information. And then at the end of this slideshow, there's going to be a way to contact us with questions, or if you feel up to it, we'll be offering free 15-minute consults, but we'll give you all that information. So have a pencil and paper ready, or your phone or whatever, to type in the information at the end. And I believe this will stay on Facebook, so if you have friends that missed this and want to watch it, I think they can still go to our Physical Therapy and Balance Centers Ogden Facebook page and watch it later on. So I'm Frank, and Josh and I work together here as the physical therapists, and we put this together. Today I'll be presenting it, and then Josh will be on the chat box. So if you have small comments or quick little questions, I believe he can answer them. But if you have anything more detailed, you can email or come in and talk to us. So our seminar today is on knee pain and dysfunction. So there's a lot of causes of knee pain. You have arthritis, ligament sprains or tears, tendonitis, bursitis, kneecap tracking issues, meniscus injuries, poor footwear, foot or ankle problems, muscle weakness and imbalances, and hip problems. So a lot of things can cause knee problems. Some of the common diagnoses are runner's knee, ACL tears, osteoarthritis, meniscus tears, chondromalacia patella or kneecap tracking problems, tibial plateau fractures, so the top of the tibia bone underneath the femur can sometimes fracture, IT band syndrome, a lot of runners and bicycle riders get that, and the famous one, you see your doctor, there's nothing on x-ray or the MRI, they look at your knee, everything seems fine, they've tested all the ligaments, they're all fine, so they say you've got knee pain, go see your physical therapist. Now this is not a dig against the doctors. Here at our clinic, when we have this kind of condition come in, we have the ability to do more testing. We can put you on a treadmill and use slow motion video and find some things that are going on when you're walking or running that you can't see with the naked eye. Okay, so the knee is a very complex joint and it's affected by other joints. So the foot and ankle can cause knee problems, and the hip can cause knee problems. So there are two kinds of cartilage. The harder cartilage is on the ends of the femur and the tibia, and it's also on the back of the kneecap. So this is really hard cartilage. When that wears out, you get arthritis. The other is the softer meniscus cartilage that cushions the knees and helps guide movement of the knees. When you tear these, you can sometimes get a catch in the knee or locking, and so they form a little C shape on both sides. And when there's a tear in it, it's kind of like when you're on a skateboard and you're going down the road and a rock comes on. When the wheel hits the rock, it can kind of jam it or stop it, and that's kind of what these can do with your knee motion. There's multiple ligaments to stabilize the knee. The ACL ligament is the most well known. You hear about that a lot in athletes, but you also have the lateral collateral, the medial collateral, and the posterior collateral ligaments, which also can be injured. There's a lot of tendons that are connecting muscles to the bones, and when these get inflamed from overuse, you have tendinitis. There's also bursas in the knee. These are fluid-filled pouches that prevent tendons from rubbing on the bones and cushion the surfaces. But if irritated, they can cause bursitis, and then each time that tendon rubs over the bursa, which is on the bone, it gets bigger like a water balloon that starts swelling. And the bursas are different. There's different ones throughout the knee. So if you have this one over the front that makes it big bubble like that, it's not as common, but that would be your prepatellar bursa. And then this one right here, the Pez-Anserine bursa, that's one that you can get if you run uphill a lot, carry heavy packs uphill, or a lot of downhill running. The hamstring muscles come in there and it gets inflamed, and so that's right there. And there's more. So the knee is affected by weakness in the hip muscles. So these lateral hip muscles here, when they're weak, the pelvis isn't stable, and that can cause problems. So you can see in this diagram, you've got the runner, and they've got a weak lateral hip muscle on this side, so this pelvis drops down like that. The knee caves in, and it causes problems. So with a normal runner that has strong hip muscles here, when they step, each footstep, they're going to hit their heel and come off the great toe. Heel, come off the great toe. If you have a weakness in one of the hip muscles, the lateral hip muscles, so you can see the first foot hits and it's coming off the great toe, but because of the weakness, this hip drops down and then this foot is going to cross over, so they're landing on the outside of their foot. So you can imagine if you're out there running after so many thousands of steps, that's going to start causing some problems, similar to a front end alignment with a car. At first you don't notice that much, then you start to notice abnormal wear and tear on the tires, and then you start having other problems with other parts of the car. So another thing that can affect the knee is foot and ankle position and problems. So here on the left we have a pronated foot, so the arch is flattened out, and so you can see the ankle caves in and the knee's going to cave in, this tibia is going to rotate inwardly. Here's a normal alignment, and here's one where you have really high arches and maybe run more on the outside of your feet and the knees kind of go bow-legged. So this would be knock-kneed, this would be bow-legged, both of which over time can cause problems. And problems in the toes. So alignment shoes and the toes get stiff and off like that can cause problems. You can start to have stiffness in the toes. So if you have normal motion here, extension of this great toe, when you run it just goes over it and there's little stress on the plantar fasciitis, the Achilles tendon, and the knee. If it's a little stiff, then it starts to cause problems where you can get the plantar fasciitis because it's putting more stress here, Achilles tendonitis, and knee problems. If it's really stiff or fused, what happens is you turn your foot outward so you can walk over this inside of your foot because this won't bend, or if you do try and walk over it like this, you hyperextend your knee and cause some real problems with your knee. How is that for a dramatic effect of those curtains? So last but not least is shoes. One of my favorite topics because over the years as a runner and as a physical therapist working with runners, I've seen so many fads come in and out with shoes. So there was the really cushion thick shoes, there's the thin light shoes, there's the barefoot shoes, and everything in between. So walking around in your favorite kick around shoes over time can cause problems. No support. Going out or wearing high heels a lot, those stilettos really cause some problems. Cause problems with the toes. Then you can get stiffness in this calf because it shortens, which is going to put more stress in this area and more stress in your knees. The five-toe shoes and barefoot running. So when those came out, like any fad, people just went out and bought them and just ran their usual distances and started having a lot of problems. So friends of mine that have learned to run in these, it took half a year before they could work up to running their normal distances in these shoes. So they're not for everybody. And again, anytime you change shoes, you need to back off, go lighter on your runs, get used to them. Even if it's the same pair of shoes you've been wearing, if they're brand new, it's going to be different. But if it's a different style, you really need to take it easy. Of course, wearing shoes too long. They were great when they started, but now they're worn out. You need to change them. My favorite pet peeve. Flip-flops are so popular anymore. So many people wear them. And a lot of them have no arch support whatsoever. You can see this foot, how flat it is. The arches drop down, which puts strain on the knee. And if you do any kind of impact activities, that can start to cause problems. And if you have any type of obesity problem, it tends to put more strain. That's just the way it is. So they're great once in a while, but wearing these all the time with no support in them can cause some problems. And of course, toenail shoes. I don't know what kind of problems this has caused, but I can sure see some that come to mind. And our favorite pick for the shoe category, can you tell what Josh's wife is wearing? I'll give you a closer look. Yep, you got it. Oven mitts, not recommended. Okay, so just to review, we told how the toes, foot and ankles, hips can all affect the knees. So here is a thermal imaging or 3D imaging of a foot that has pressure on the heel, the balls of the feet and the toes, but the arch, there's not a lot of pressure, so it's got good arch support, which then keeps the alignment of the leg straight, level at the knee joint, The kneecap is tracking right in that V normally. Now when you have problems with pronation, so that inside foot caves in, the tibia or the shin bone rotates inwardly, the knee moves in inwardly, and you can see there's a difference in the gap there and there. You start to put more wear and tear on this side. The kneecap starts rubbing on this edge here, and that cartilage on the back can get real sore, and that's just the beginning of your problems. So as you can see in this diagram, foot caves in, foot and ankle problems, rotation, knee problems, kneecap tracking problems, hip problems, rotation. You can get bursitis, IT band syndromes, inside knee pain, just a lot of things, especially if you're a runner or some type of high impact activity athlete or exerciser. Alignment problems. So here's some pictures. So there, if you have a strong hip muscle on this outside, you can see the pelvis stays level when he puts all the weight on this foot and it's aligned. And here you can see how the knee caves in, the rotation, and that could cause problems. So on this person, you can see as they run, they step down. This is weak, hip drops, knees come together. Not a good situation. Here's another one. Weak hip muscle here, pelvis drops, knees are almost rubbing together. And here you can see some professional runners. I think they're Olympic athletes. See these four strong hip muscles, their pelvises are all level, the thigh is going straight down, the alignment there looks nice, and you see there's space between their knees as they pass. Now look at this gal here. Weak muscle, pelvis dropped, thigh turned in, knee angled in, and you can just see that just looks like that's going to cause problems over years compared to these. So these are the types of things when you come in to see us, we can put you on the treadmill and we can film you with slow motion video, and we can pick up these types of problems and then decide what's going to be best to help you, including hip strengthening exercises, shoe wear, arch supports, whatever it may be. So common causes of pain with runners. So training errors. You decide you're going to run after watching Olympics, so you start running, you run too far too soon. Or you start picking up the pace too fast too soon. Or if you live around here, you start running too many hills too soon just because there's so many hills to run. Running on crowned roads, so the middle of the road is high and then it slopes down to the gutters. So if you always run facing traffic, then your left leg is always going to be downhill. If you always run with traffic, your right leg's going to be downhill, and that's a common cause of developing IT band syndrome or iliotibial band syndrome. Running the same way around the track at the high school every day puts more stress on the outside knee. Doing strength exercises incorrectly or adjusting your stride length. So I used to run marathons, and I remember watching the Olympics one time. The announcer had an expert with him, and they diagrammed the stride length on some of these long-distance Olympic runners. It was a really long stride. Well, in my wisdom, I decided the next time I went out for a training run to lengthen my stride. And 3 weeks later, I was able to run again when I recovered from that. So, just because somebody has a stride length, a certain shoe, does certain exercise, does not mean that's the right thing for everybody. So equipment, new shoes that you change and do the same run that you did in your old shoes. Shoes that are old and worn down, broken down. Too much arch, not enough arch, or bad fashion. Okay, so as far as physical problems or anatomical problems, so overpronation, oversupination, so this is the inside arch caves in, this is you're running on the outside of your feet. Knock knees, bow-legged problems, stiff joints, weak muscles. So an average runner, when they're running with each step, and they come down on each leg, that's 1.5 to 3 times your body weight. So you can imagine doing that several thousand times in a run, how much damage you could do over time. So doing exercises with bad form. See the knee alignment, which would be the same as running or jumping with pronated feet versus the correct way, correct alignment. See how far her knees are out over her toes versus this, which puts a lot less pressure on the kneecaps and builds the strength of the thigh and glute muscles. So here we go. Here's your test. Okay, going the same way around the track. Is that technique? Is that equipment? Or is that physical and anatomical problems? Okay, technique. Okay, always going the same way, so the outside leg is going to take the most stress. Okay, shoes. Changing shoes, barefoot shoes, worn out shoes. Technique, equipment, or physical anatomical problem. That's an equipment problem. Okay, so this is supposed to be an example of a crowned road. So higher on the top and then slope to the side. So this leg is going to take more stress. So is that an example of technique, equipment, or anatomical physical problems? Again, that's a technique problem. And here we have overpronation or supination. Yep, that would be anatomical problem. So any of these things or all three together can cause problems. Okay, so here's the crux of the matter. Here's this what's important. If you have knee problems, what are your choices? You can grin and bear it and still injure your knees. You can use essential oils or rub icy hot on them and still keep injuring your knees. You can wear wraps and braces and still keep injuring your knees. You can take anti-inflammatories or have cortisone injections or Synvisc injections and keep injuring your knees. Or you can keep going till you have surgery and then you stop injuring your knees, but you can't do anything for a long time. Better choice? Come see us and let us help you find out what's wrong, fix the problems, and get you doing the right exercises to get those knees back in shape. So that's our seminar today. Thank you for joining it. I hope that worked out well. If you liked it, you can put it in the chat box, or if there's a like it, mark that, or you can email us, and we will continue to do these on different parts of the body. If you have questions that require more of a longer answer, then you can put in a chat box. Couple things. You can either call us at 801-476-2000 for a free 15-minute consult, and our clinic is open for business. We're considered essential workers, but we have people come in about once an hour, so everybody's spaced out, so we're able to follow the CDC regulations and keep everybody safe. So if you want to do that, just call us and we'll set that up. If you're not comfortable coming in, but you have a question, you can email your question to fromney@physical.com, and we'll do our best to answer your question via email. If you have family or friends that you think would benefit from this seminar, they can go to our Facebook page, which is Physical Therapy and Balance Centers Ogden, and watch the presentation. I believe it'll stay up on there until we delete it. And they can also read some of the other posts that we've done recently on the back on our Facebook page. You can also follow us on our Instagram page at physical.therapy.oac. This coming week we will have some posts regarding adolescent athletes and knee pain that you won't want to miss. There are also other posts on our Instagram. We've just recently done a 3 or 4 part posting with pictures and videos on the low back, so if you're interested in that, you can see those as well. So again, if you enjoyed this presentation, let us know, and we'll continue to present these live Facebook seminars until we get past this COVID-19 pandemic and can start presenting live seminars again. So thank you. Be safe out there.